actually talked about cesareans, and I needed one, and it was very helpful to have this information. Big deal. Having surgery, it's highly medical. It has longer recovery time. It can be done for an emergency. All of those things that you outlined are very, very accurate. And at the same time, it's when your baby's taking their first breath. It's when your baby's going to hear your voice without the watery womb and the wall of muscle. It's when the first photographs are going to be taken. It's a time to advocate for yourself. You can listen to music. People can receive massage. Like there's a lot of cool things that happen as well. One of the things to be aware of is there's a lot of bright lights. This is something that a lot of people are surprised at. Um, Sometimes the lights in the operating room, they are such that they're reflective. And I know some clients have been like, I can see what's happening in the reflective lights. And so if that were, I tell people that because some people will bring sunglasses if they're planning ahead and know they have a cesarean, they'll bring sunglasses. Other people might just keep their eyes closed down, or even having a washcloth putting over their face if it's too bright can be a good idea. There are a bunch of people in the room, and they're all wearing protective gear, which can be challenging if because they all can look like strangers, and that can be something that's surprising. The other thing that happens during a cesarean, especially the more urgent it is, those providers, they've got one job to do. It's not customer service. Their one job to do, not two jobs. They have to get the baby out quickly, and they have to make sure that the surgery goes smooth. And there is three people usually, and then so there's the two doctors and the assistant, as photographed here, and then there's an anesthesiologist. So there's like three doctors working on someone at the same time. It is a very major surgery. There's usually, so that is something to be aware of. If they're not chatty during this time, I always tell people it's a good thing. It means they're focused and they're working. Um, Cesarean scars can be vertical or horizontal. This is kind of an old-fashioned technique. Now, I would say 100% of the cesareans that I've seen have a horizontal scar. Um, it would only be an emergency situation where a vertical scar would be. Some people put this in their birth plan, and it's like it's not necessary. There's a lot of like monitors that can be a little overwhelming. How it looks is, well, let's see here. If this is the room, usually there's some big double doors, and there is a bed on this side of the room. There is a chair here. That bed is too wide. That bed is too wide. It's a narrow bed. Okay, so there's two chairs. As the doula, I prefer to sit here. Partners often sit here. And the person who's having the procedure is here. There are some wooden boards where their arms are stretched out. In the olden days, there was these cuffs that were put on around their arms to kind of hold their arms down. They don't use those anymore. And if somebody did start to put them on one of my clients, they would pretty easily be able to say, no, I don't want those. That's kind of an old-fashioned thing. Let's give this person a personality. There is a lot of people in the room. So here is the anesthesiologist. They're at a computer. They have like a bunch of computers. They've got a whole box of, it's like they have a whole stack of drugs in this box. And there's probably like one more computer. And then there's a lot of electrodes that are kind of coming back to these monitors, a blood pressure cuff, um, On the finger, there's usually like a heart rate monitor. So there's a lot of stuff happening. There's also a blue sheet that goes up right here. So this is a vertical field. Oftentimes nowadays, the blue sheet will have a window in it. And when the baby is almost coming out, families can ask for the little window to be opened up, and the family can actually see um, the baby coming out. And the providers will like hold up the baby, and sometimes they'll lay the baby on the plastic. It's pretty cool. Some people really want to see, and other people are like, not interested. It is good to note that if a partner is standing up, which usually partners would be sitting down, but if a partner did stand up and they were tall, they would be able to see over the sheet. So I always like to tell people in the operating room to make sure they know where their eyes are and body is going, because some people really want to see all of the intricate details of surgery and other people definitely do not. There is a one of the surgeons is here, the other surgeons is here. My favorite person in the room, other than my clients and the baby, is the person that stands over here in the corner. They know what's going on in the room. And if they speak, everybody listens. I've heard them say, like, the table is tilted to the left or something. And everybody's like, oh, they're just making sure everything is going smooth and that the doctors aren't messing up. There is, I don't know what, there are these boxes that are filled with tools. There's usually a nurse here to assist the doctors if they need it. There is a little, this is like a baby tanning, they call it a baby tanning bed. It's just a warming lamp for the baby, and then some tools attached to the wall that are, this is like where the baby central is. And then there is a nurse ready to receive the baby. And there's usually one more nurse that is just kind of a general helper. So it's a lot of people in a room that's not that big. The whole procedure takes about 50 to 60 minutes, but the baby is born after 10 minutes. So there is a lot of time where, so the baby, the general surgery, opening up, taking out the baby takes about 10 minutes. So let's say the surgery is about 10 minutes. And then the baby will go plunk right over here. And the baby will go here for about 5 minutes. It they try to do they try to make this pit stop as quick as possible, but there's just certain things that they have to do for the baby. They give the baby a wristband, they weigh the baby, they take some measurements, and they do it all there very quickly. And then they don't have to do those measurements later. So in some ways, it means the baby doesn't have to be taken away from the parents again. But it feels like an eternity. I know that people are like, I want to hold the baby. It feels like longer than 5 minutes. And then the rest of the time, the baby is over here. So the baby usually will go kind of on the chest. And sometimes if that feels, sometimes it feels kind of restricting because the baby can be like laying on somebody's chest or neck. It can be kind of overwhelming. And so I would invite sometimes I do this, but I invite the partners too, to hold the baby here so the baby can be face to face with the person who's having surgery. And angling the baby sideways so there can be like smooching and kissing and backing the baby up a little so they can like lock eyes with each other. This is when someone is meeting their baby for the first time. And this part is often pretty cool. People are like, it's my baby, it's here. Like the baby's here. it also is still pretty overwhelming. And just like we talked about the stages of labor being like mild, medium, spicy, and then there's like, ah, like it's really intense. For a surgery, that intense part happens about 10 minutes, the like at the 7 to 10 minute mark is when it's really intense. People can feel pressure. They feel tugging, they feel pulling, they don't feel pain. But it is not unlike a dental procedure where like you may not be able to feel the pain, but you know something's going on in there and it's uncomfortable. People that have cesareans, they still need coping practice. They still need comfort measures. All the things that we talk about in class, breathing, non-focused awareness, touch, right? So as a doula, I've usually got my hands on. I'm like giving a scalp massage really slow, going down from the neck and up. I'll massage their jaw. I'll hold their hand. Sometimes I'll put my hands on their chest and just be weight on their chest. If the pain medication, sometimes the pain medication, the numbing medication can creep up into the upper region of the body, so above the abdomen. If that happens, sometimes people have a really hard time feeling the breath going in and out of their body. That can be startling. Some people have a little bit of anxiety, and remember I said this guy has all the drugs. I've worked with clients that have been like, "Excuse me, I'm feeling anxious. Can I get something?" And they will be administered medication for anxiety during that time. It doesn't happen frequently, but I know some clients that's been really beneficial. Um, some people vomit, which is normal in any part of labor. It's uncomfortable, and a nurse will come over to help. Some people will shake. This is true in any type of labor. Their body will start to just quiver, and they're not cold. It just is a response to medication and the huge change that's happening. So this can happen in any type of labor. It's not a harm. It's uncomfortable, but it's not causing any harm unless somebody like bites their tongue from the chattering. Um, the there's like noises and sounds that are uncomfortable to listen to. People can listen to an earbud, or a lot of times there'll be like a little speaker right here, like a cell phone speaker, and music can be playing. During this time, what I do as a doula is if I hear my client say something, maybe my client says, "I have a headache." I turn my face towards the anesthesiologist and I say, "They said they have a headache." And then the anesthesiologist will talk to my client. Oftentimes someone is coping, that sometimes they might be mumbling or they're whispering. So my job is, if it's relevant to their medical care, I just am a parrot, a loud a loud kind parrot. They said they can feel something, and that's one of my main roles. When in this situation a person does not want to make themselves the main event, my job is to make myself small and listen to direction, right? I'm there for my clients and I'm often talking to them, advocating for them. Um, but it's very small. Just and partners, if you have questions, the person to ask is the anesthesiologist or this nurse over here. So if anybody has a question, the nurse or the anesthesiologist, these folks right here, they are not going to be paying attention to what you say. Again, for good reason. There may, if there's a complication, they may or may not say anything to you. This is one of those situations where if there's a complication, again, they just have to do the work. They don't have time to be like, "Can we consent to this X, Y, and Z life-saving procedure?" They just are going to get the work done. If you have any questions in any type of situation, go to the nurse. The nurse is the person to talk to. That they're usually the best person for information. So after about 40 minutes, if everything's going smooth, you'll people will find in the situation that like, "Oh, that person, oh no, that's not what I wanted to do. Um, let's see, I want to erase this person, but I want to make my eraser small. Okay, so this person will disappear. And it's like, oh, interesting. And then eventually this person will disappear. And then this person disappears. And there's only like two people. That's the wrong person disappeared. That person stays. How do we get that person back? That person stays. Let's come back. I can't get that person back. Here we go. Sorry, I deleted you too soon. And then one of the funniest things happens. I know cesareans aren't hilarious, but they will bring in a bed and no joke, they have this inflatable pad, like a camping mat. They inflate it and then they say, heave ho, 2, 3, and they drag the person post surgery over to the new bed. It just, it's, it just is a funny thing. They drag on the mat. They pull them over. It just is like a silly, like, looks like a slip and slide or something. Um, then the baby gets, so in the new bed, the baby gets tucked in and whoop, they go back to their room. There's usually two nurses in the back of the room. The anesthesiologist usually comes in to make sure everything is set up okay. And then time to feed the baby and everything else goes off as normal. There's going to be more monitoring in that first hour postpartum, more blood pressure checks, more bleeding checks, but everything else is quite the same. Um, Someone will have a catheter in for a while until they get up and go to the bathroom, which is usually the next day. They slowly start gaining their feeling back. It can be painful, and so pain medication postpartum is really important. Some people can make it on Tylenol and ibuprofen, but a lot of people need some stronger pain relief. When it comes to postpartum pain, um, it does not make someone a hero if they don't take narcotics because again, it's into like pain versus suffering. So everybody's pain tolerance is different depending on how intense the surgery was, depending on how tired they were. Some people are going to need that stronger pain medicine. After about 2 hours in the postpartum room or 2 hours post birth room, they go to postpartum just like everybody else. Recovery is more challenging, um, but resting is going to be really important. And again, just being aware of anything that doesn't seem normal or anything that doesn't make sense. But it is surreal. That is the word that most people use. Like this is what was a really surreal experience. But remembering that the task of labor, no matter how it happens, is to cultivate the most positive memory possible. So someone doesn't have to love any experience, but can they walk away saying that they did what needed to be done and stood by their values? One thing that I want to mention is that after the baby is born, the baby will come over here and the nurse will say, partner, do you want to come and see the baby? And partner will go, stand up. So the person will go, stand up and go, walk, 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 walk. So now they'll be over here. And babies, when they come out, they're looking kind of weird. Their head can be misshaped. They got that white vernix all over their body. Their coloring is weird. They're kind of looking like grayish, bluish, goopy looking. Their body's all folded up tight. They just look kind of weird. So partners go over and they're like, oh, that baby needs help. Sometimes babies look weird and they need a little help taking their first breaths. This is a normal part after a cesarean. And so it's like, I can't really do anything. I'm going to go sit back down. What happens when they sit back down? They turn this way. And what might their eyeballs see when they turn? All of a sudden, this point right here in the turn becomes a moment of trauma for partners. Because on one side, they see their baby that needs lots of help, even though the baby, it all might be totally normal. And then to the right side, they see their partner's abdomen open. And in this moment, it can be a terrifying, terrifying thing. And so I always like to tell partners, everybody, to know where they're going if they decide to stand up and see the baby, and to always move this direction back to the chair, back behind the screen. I have two of my best friends gave birth by cesarean, and they both said that the hardest moment was when they were looking at their partners who were looking over the screen and had to witness what their partner was, their facial expressions of their partner. So this is a cesarean in a nutshell. What feelings are coming up for you as you listen to this and learn more about this procedure? And a lot of people go through this experience being like, I don't want this, I don't want this, I don't want this. And they do want to hold their baby. And so I, as a doula, if I'm with somebody in that frame of mind, I'll be like, it's like really it's all about the baby and those in so like shifting that focus can be very, very helpful. But it is not a walk in the park. It is not easy. Doesn't having this drawing or having more awareness doesn't make it easy. It's hard. No matter how a baby comes out, it's gonna be like for I'd say 99.9% of people, it's gonna be a challenge. It's gonna be something that people have to a hump people have to get over. Um, so I always just think about this as it's a different path. It's a different path. Oh, you could ask to not have the blue sheet, but the blue sheet it creates the sterile field. So everything above the blue sheet is nasty. Everything, no, just joking. Everything below the blue sheet is sterile. So they one of the first things they do is they clean and clean and clean. Sometimes they'll even clean up into the vagina if the baby's very far down in the birth canal. One thing they can do is they clean up in the vagina and sterilize the vagina. Um, so there needs to be some sort of sterile field. Some if there is a if someone did want to see the whole thing, a person could ask for a clear drape. So they may have a drape that is 100% clear. That could be a possibility. Another possibility is to open the window the whole entire time, to say, I want to have the window open. I've seen people do that before. I don't know. People in the operating room, they all have like different rules about what is allowed, what's not allowed. So please don't if I say yes, that would be allowed or should be allowed, it may not be because the anesthesiologists and the nurses all have their own different weird power trips or rules that they've created based on their experience. Um, can you bring a phone into the OR? Yes, I actually recommend it. Um, and I didn't tell you the most important part is the partners and doula get to wear this goofy outfit. So one of the things that happens still in the room is there is a painter's, what looks kind of like a painter's outfit, and it's got a zipper all the way down. It's flimsy fabric. There's also these little foot booties that go over the shoes. If someone is a very big person, they have PPE that can be almost like it's more of a gown. And so if somebody is a larger bodied person, that can be an option for people. Because these are, yes, one size fits a lot of people, but not all people. And then partners get a beautiful hairnet and are asked to wear a face mask, although a lot of partners pull down their face mask when the baby is born to see them. So here's a couple things. I had a nurse one time tell me that um, they she gave the little outfit to the partner, told them to change, came back to the room, and they were naked below. These things are kind of see through. definitely want to wear clothing underneath the this outfit. Um, and then the other thing I'll tell you about the phone, people can hold the phone, but you people can also like rip a little tear in it and access their cargo pants that I recommended them they wear to the actual birth. So that way you can access your pockets.